Hello, everybody. Here we are in the virtual room, and we're ready to start the presentation for today. Thank you to be here, and we will start the presentation. I will give the talk some of the people of the Spine Action to present our webinar, and then we will start our presentation. Okay, Krishna. How are you, Krishna? Do you want to talk with the people?
Hello, sir.
Here? Yeah.
I'm very well, thank you. Yeah, I would like to welcome you all on behalf of Team Spine Action for our temporomandibular joint disorders and physical rehabilitation webinar. We're really looking forward to it, sir. So I hope you all have a good time today. Thank you so much for joining with us today.
Thank you so much, Krishna. Thank you so much. We're ready to start. I will do the voice to the other staff of the Ashish. How are you? Do you want to talk with the people who are here in the virtual room? You have the microphone? Yeah? Hello? It's not microphone. Okay, Krishna, we will start. I give you the voice to you. We will start with this nice webinar in our virtual room. Yes, and we will.
Yeah. Good evening, sir. How are you?
Hello. How are you? What are you?
Yeah. Can you hear me?
Yes, I hear you. Yes.
Hello.
Yes. Can you put your hand up, and I will put you in the panel, please. And could you put the hand up in your?
Sir, he's already in the panel list. Ashish Kandela.
Yes. Okay. But it's not. It's muted. Can you talk now? Yes, Ashish. Yes. Can you try? Before I hear you very well, but now I not hear anymore. Check your microphone. Okay, later you can talk, okay?
Hello.
Okay, Krishna, we will start. What do you say? Yes, we start the webinar? Yes?
Yes, sure, sir. We'll start.
Okay. We start
Yes, I can hear you clearly, sir. Can you, am I audible?
Yes, I hear you, but I don't see you.
I hope I'm audible.
Yeah, hello, I can hear you.
Can you hear me, Dr. Krishna?
Yes, I hear you. Yes, I hear you. But I hear you and you have the microphone. Can you hear me? Yes, I hear you, but can you talk now? And then we open the microphone myself, yes. Now the microphone is open. Try to talk. No, don't close it. Try to talk now, yes. Because maybe it's some delay from the internet, yes. Can you talk now? Yes. Okay, no problem. We will start the webinar later. You can say hello for the people. All right. Okay. Let me open the PowerPoint, and I have to say hello for the people who are listening to us here and also in Facebook, because our presentation is in Facebook. The only thing is the people who are in the Facebook, they will not have the certification. Only the people who have already registered in the virtual room have the certificate. Okay, and let me share the presentation, and then we will start our webinar today. All right. Okay. I have to say thank you so much to be here, everybody. Here is not nighttime. I know in India it's nighttime now. It's very late, and in Sunday, after the relax of Sunday, we are here just to listen this webinar. And this is one webinar that we normally do. You know, we normally do webinars in all languages. Today is our school is speaking English, and for the people who is English speaking. And this presentation is just to introduce for all of you a concept that to have a good physical rehabilitation, we have to have in the whole body a good balance. That's very, very important. and the craniofacial system you will see today is part of our body, and is a part that when we don't have a good function, it's interfere with the rest of the body for our rehabilitation. You will see today the connection between the upper part of the body and the lower part. Normally we said TMJs. When we say TMJs, we are talking in a very simplified way. Talk only regarding the TMJs only. It is not good. And I will explain today why it's not good. TMJs is a particular joint who is part of a big system. His name is craniofacial system. And you will see how today it can interfere in our rehabilitation. Pay attention in this seminar. This seminar is very important to understand the connections between craniofacial system and the rest of the body. And remember, TMJs, it is part of craniofacial system. And you will see how today is interfering in the rest of the body, okay? You will see the effect of the TMJs into the oculomotor system. We said the eyes, no, but the eyes is also very, very simple to talk in eyes, just very, very simple. The eyes are into another system, which is the oculomotor system. And the oculomotor system is into the craniofacial system. As you see, all our body is connected. It is impossible to treat the body only in one part. Very, very, very difficult, to do not say impossible, because our therapy will relapse. We're coming back. And it is not the technique we are using, but our diagnosis concept. We talk, there is a diagnosis concept, holistic. We have to do diagnosis and treatment holistic. And M.P.R, the myofunctional postural rehabilitation, is a method to do that diagnosis and that kind of treatment. Today we will see one part of the concept, is the connection between TMJs, eyes, feet, and muscle change. The people who are here, who is people who did with rehabilitation, these people know very well, they know very, very well that the rehabilitation is not easy. The rehabilitation is not easy at all. It's not easy at all. We have different techniques to do rehabilitation, but I know very well that we never treat the craniofacial system with the method together with the postural system. We say tonic postural system. You will say today the connection, and you will understand that you have to work with the holistic protocol for an holistic therapy. And it is very important to all these things to have a good mandibular position with the rest of the body. And when we are talking mandibular joint, we are talking in TMJs. When the joint, the mandibular, the jaw is changing the position for different reasons, it will create local pathology in the TMJs, but global pathology into the whole body, into the rest of the body. This body is connected, upper part of the body and the rest of the body. That's very important to understand, please. It's very, very important. At the end of the presentation, if you want, you can do the question. The people who are inside the virtual room, they can do the questions regarding this topic if you don't understand very well, or if you want to know something more. Well, that was said from the TMJs to the eyes. First topic. How can affect the TMJs the oculomotor system? Oculomotor system, the people who learn posturology, they know very well that the oculomotor system is one of the main receivers of the tonic postural system. Imagine if we are altering this receptor, who have to deal with our muscle change to have a good balance. We will not have never good balance in our body. As I told you before, T.M.Js is a part, as you see there in the picture, T.M.Js is into the craniofacial system. We cannot talk only in T.M.J disorders. It's craniofacial disorders. The eyes is one of the main receivers of our tonic postural system. The tonic postural system is a cybernetic system. We are not talking here regarding posturology, but just to introduce all of you to what is the oculomotor system. Oculomotor system is one part of the receiver, one main receiver of the tonic postural system. And it's very important that, because it's regarding with our posture. And if that receiver, this receiver, is not working well, we will never have balance in our body. Remember that, please. How do eyes affect the posture? The eyes affect the posture in two ways. The refraction and the oculomotricity. What I mean? Refraction is the vision. If we have some problem in our vision, we will affect our posture also. But also if we have some problem in the oculomotricity, that means the movement of the eyes, also we will have alteration of the posture. Oculomotricity is dealing with the peripheral vision. And the frontal vision is another thing. That means if we have alteration in our oculomotor system, we will have alteration in the frontal vision and peripheral vision. And that affects the posture in the way, sagittal way and transversal way. The frontal vision is altering the sagittal posture, and the oculomotricity is altering the transversal posture. That means we will have overloading in our body in all sense of our space. TMJs, you will see, it will affect this main receiver. When we have a T.M.J disorder, is altering one of the main receivers. What is affected? How is affected? Is when it's losing the central relationship of the jaw. That means lateral changes, lateral deviation, also forward or back position alteration of the jaw. All these situations will alter our main receiver, who is the oculomotor system. Look at here, forward position, retro position, lateral deviation. Three main changes that we can have in our jaw. In our school, we don't talk anymore regarding class 3, class 2. We're talking regarding position of the jaw. We can have a jaw with altered in sagittal way. That means forward position or retro position of the jaw, or the jaw can be altered in a transversal way. That means a lateral deviation. The mandibular position directly affects one of the most important postural receptors, who is the oculomotor system. Unilateral changes of this position, that means lateral deviation, intrusion, or extrusion of the condyle, this affects convergence unilaterally on the side, left or right, of the major change. And the posture is sliced laterally. What they mean? They mean that when we have lateral deviation, we will affect the oculomotor system. That means the convergence, the movement unilateral. We will lose the peripheral vision and we will adapt our head at that situation, and we will alter our body. Imagine, if you want to do a rehabilitation to put the muscle change in balance, and you don't take care on it, your rehabilitation will not be permanent. That's very important concept. Mandibular position also, we said, is directly affect one of the most postural receptors, oculomotor system. Bilateral changes of the position of the jaw, that means the forward position alteration or retro position alteration. Did this affect convergence bilaterally, affecting the posture in anteroposterior direction? That means when we have a forward or retro position alteration, our body will be altered in the sagittal way. And imagine, the jaw position is altering the oculomotor system, and the oculomotor system is altering the posture. That is one way, not the only way how we can alter the posture. But imagine, that is very important. If we don't take care in these topics, we will never have a postural rehabilitation permanent. This is a research I did many, many years ago, measuring with an instrument what happened with the body. It is a posturometric scale that measure. That is not subjective, it's objective. We study what happened with the jaw position, the different examinations, And we discovered that mathematically, when the jaw is changing with one side, imagine that that case, the left jaw deviation altering unilaterally the oculomotor system here. And then, if you see here on the bottom, we increase the overloading laterally. What they mean? 1 kilos with the mouth open and 5.2 kilos to the left for in the next registration. Occlusion and not occlusion with a lateral deviation. Look at that. Same here. Lateral deviation, hypoconvergence, one side only, and then overloading, changing the body. And here, that we have here the forward position of the jaw, bilateral hypoconvergence. And look at here, sorry, laterally will not change, but is changing the position of the barycentre. Please reflect in that topics because it's very important for when we are doing rehabilitation. It's very, very important. And sometimes we don't take care on it when we do rehabilitation. Look at that. Here we have a child, is a young lady, hypoconvergence, as you see there, cannot maintain. And look at, and here, the occlusion. Look at there. Another patient, hypoconvergence, and something in the occlusion, the jaw position. Another young people, hypoconvergence, and the jaw is not centrated. I can show you a lot of patients. Look at that. Hypoconvergence and joint alter through the occlusion. We have to take care on it if we want to have a good posture. We have to investigate what happened into the body and understand the connection between the systems. If we want a good and permanent rehabilitation, and easy rehabilitation, if we annihilate these things, our rehabilitation is better, better, and better. Look at that. Hypoconvergence. And look at that person was operating a lot of times because have pain and nobody look in the other things. The surgeons do only operations. Anytime have pain, more operation, and more operation. Look at hypoconvergence and adaptive scoliosis. Scoliosis is an adaptation when the muscle chains are not working well. The column adapt into the body, but we have to individuate, investigate if the whole system is in balance. That is very, very important. Look at that, the T.M.Js, and look at that, the closing of the jaws, open and closing, no rectilinear, and hypoconvergence and occlusion. That picture, that schema is repeating every single day. But that is very important to investigate in child, because the child is growing. And if we can put in balance the craniofacial system with the rest of the body, this subject will be an adult without any problem. And that is important to take into account the loss of this mandibular central relation in a child also. And it's evident that all these changes in posture are directly conditioned by dental malocclusion. These block the altered position in place. All these can be corrected easily during the development age, during the growth, by the use of the craniofacial orthopedics treatment, specifically aimed to guide and stimulate a healthy, balanced growth at a young age. That's very important. This is prevention. In this age, we can prevent the future. Remember that, please. Now we're going to see how that situation can alter the fit. And someone can say, well, that is impossible, no? To the joint alter the fit. It can alter the fit chronically, obviously, not immediately. But if we know that, we can prevent future damage. When we are talking regarding the foot support, we are talking regarding about another postural receptor, the foot, the second postural important receptor. And if this is not working well, also it can alter muscle change and posture. That's why it's very, very important to understand and study, investigate what happened with the foot support related with muscle change, related with the craniofacial system, and another thing. But today we are talking only in this topic, this particular topic. And it's very, very important to understand this concept to work in an interdisciplinary way. In M.P.R, the myofunctional and postural rehabilitation, we teach that language for the whole medical sciences, to all of them understand what is the problem, do the same diagnosis, and also the same therapy, coordinated. That's very important in rehabilitation. Most of you are people who are dealing with rehabilitation. Most of you are physiotherapists or osteopaths here. Again, TMJs, we have to remember that TMJs, it is not, it is not a problem. It's not a problem. The problem is the craniofacial system. Remember that. Foot support, another good thing to understand. The foot support is very important for our posture, but we know very well that the foot support is the foot is the most adaptive part of our body. That's why he has a lot of bones, joints, ligaments, and muscle, because he has to support the whole weight of the body. That's very important to understand. And imagine if the craniofacial system alteration, the craniofacial system dysfunction will alter this proprioceptor. How? Through the muscle change reaction. We said that we have a muscle change reaction when something happens on the top of the body, the middle of the body, or in the lower part of the body, the muscle change reaction. The muscle change dysfunction is directly connected with the structural alteration. And we said in our school that it's not a muscle change perfect that always is the same, but it's a muscle change reaction. When we do something in one part of the body, we start a muscle reaction to the rest of the body. And this is the connection between the upper part of the body and the lower part of the body, the DIAGNOSE system. DIAGNOSE system is not just the DIAGNOSE bone. It's the DIAGNOSE bone and the muscles, upper DIAGNOSE, lower DIAGNOSE, who connect the upper part of the body and the lower part of the body. And the upper muscles of the DIAGNOSE systems, they are connected with the jaw, in the jaw and in the neck. That means that any time we have a change into the position of the jaw, we will alter the position of the neck or the activity of the neck, and also we will have postural alteration in the future. But the lower part of the DIAGNOSE system is connected with the lower muscles. Anytime we have changes in the jaw position, it will alter slowly and chronically the lower part of our body. When we have a lateral deviation, as you see there, it's altering the lower DIAGNOSE muscles. And the main effects we see is the inclination of the biclavicular plane, that is a virtual plane. And if this reaction is going slowly down, it will alter the lower part of the body. Look at that. Another measure. A lateral deviation when the patient is on the right side with the mouth open, it happens in the body 4.6 kilos of alterations to the left. When this subject is closing the mouth, like as you see on the left side of the picture, the overload increase to 9.3, and that is immediately. We do the registration with the person, the body balance, the mouth open, we register the situation, and then say, please close your mouth, and that is the situation, immediately. Imagine the whole life doing that. It will increase overload, and it's increasing pathology in our body by overloading. Imagine how you can do a good physical rehabilitation if you do not annulate that situation. It's impossible. Also, when we have changes on the forward or back, also we have alterations. The jaw's retroposition paired with the loss of the vertical dimension generate hyperactivity of the suboccipital area. What that means? When we have mainly a position on the back of the jaw and the highest of the lower part, we call that vertical dimension. When that is less than the normal, it's creating hyperactivity, mainly into the suboccipital, but also gradually this is descending and if becoming chronic and creating adaptative scoliosis, which ultimately leads to podal support malfunction. And also it's creating hyperactivity in the whole muscles of the cranial system. And that alters the craniosacral breathing and block the cranial sutures. Chronically, when we go in chronically, it's affecting the lower part of the neck. All masticatory system alterations affect the cervical system and gradually descends until its effects reach the feet. Obviously, it's not in one day. It's slowly. Chronically, we go into the trapezius, grand dorsal, and the joint of the arms, the scapular joint. And slowly, we create hyperactivity into the column, and is going slowly to the lumbar and slowly to the feet. The muscle chain dysfunctions and structural alteration, we have to pay attention on it. Yeah? The lateral deviation of the jaw is creating alteration of the posture, as you see. This patient, great overload. The jaw position in M.P.R is essential. If we lose that, our system will create chronically a lot of problems, a lot. And imagine that we have the T.M.Js who is dealing with the posture. With the posture is imagine that. Imagine that how we can alter with our system, how we can alter with our craniofacial system. This function, it can alter the posture of the body. For that reason, we said craniofacial system dysfunction and posture. The jaw position, remember, is very important. Very important. The position of the jaw, we have to have the jaw centrated. Sometimes we lose that for an accident, for a fracture. Sometimes for our treatment, and sometimes naturally during the growth. But it's very important to understand that our jaw have to be centrated. That's why in our school we said the main things we are doing is the deprogramming of the jaw, rebalance of the body, and then reprogramming the jaw position. If we will do that, we will have a good rehabilitation, the long date. Look at the changes of our jaw. And when we have an alteration like this, our body needs to have the barycentre the most closely to the barycentre of the heart, because there we use less energy. And it's for that reason, when we have these alterations in the receptors, our body adapts with an scoliosis to found a good barycentre closely to the barycentre of the heart. That's very important. Look at that. Our Pisa Tower is not in a good barycentre. And slowly, when we have some problem into the teeth, you will see how it affects this schema. Our foot support is divided in a triangle like this. One point of the triangle is the first metatarsus, another is the fifth metatarsus, another is the calcaneus. If we join all of them, we have a triangle. If we trace the bisectrices of the triangle where they meet together, we have the foot barycentre. And the foot have three arches: internal arch, metatarsus arch, and external arch. And when all is in balance, we have the barycentre of the foot in the barycentre central area of the body. Many years ago, I did a research putting the pre-contacts in each teeth to see and measure what happened. Anytime we put a contact who work changing the jaw position. Anytime we put pre-contact in the front teeth, we observe that we lose charge into the first metatarsus. Anytime we put the pre-contacts in the occlusal plane, and we got loosening of the charge in the fifth metatarsus. And anytime we are putting pre-contact with the back teeth, we lose charge into the calcaneus. Imagine what happened anytime chronically, that if that we see immediately. Imagine what happened chronically. That is the schema. First metatarsal, we call that anterior guide. Fifth metatarsal, we say occlusal plane, and the calcaneus speaker. Anytime we create pre-contacts in these areas who affect the centrated jaw position, it affects one of the support areas of the foot. Imagine what important is to avoid that, to have a good muscle change balance. And that is very important when we have a child, because when we have a child, as there, imagine this little lady who have a foot problem, torsion in the body, oculomotor system problem, growth problem. In that age, we can prevent the future. This is the age to prevent, to do prevention. To do not arrive like this. This is not the same patient, it's another one. But this lady, if we will treat her in this age, she will never arrive like this. What I am saying all these things? Because it's not the technique for rehabilitation, it's the concept of diagnosis and treatment to use a good technique. Oculomotor system, jaw, foot, and we add also psyches and biochemistry. All the scoliosis, most of them are functional scoliosis, that if we avoid the aggression into the muscle change and some soft physiotherapy, we will resolve the problem of the scoliosis. Look at that. Foot support, the jaw, and the alteration of the body. An unbalanced craniofacial system alters the balance of the tonic postural system, and that's very important because tonic postural system, as his name is saying, is creating the basic muscle tone for our body. If this system is not working well, we will never have a good muscle change. In these cases, it is necessary to prevent the nociceptive information from reaching the central nervous system. We call that in our school deprogramming. Deprogramming the aggressions. This process is called deprogramming of the aggressions. Take out the things that are making interferences with the tonic postural system. Then we will have a good rehabilitation. We have an instrument. This instrument is called B.E.D. B.E.D is a simple device that can use also the physiotherapist. It's a device to annulate physiotherapists, osteopaths, and doctors. This is a device, a special device to deprogramming the craniofacial system. Very simple, with a special material. This material, thermoplastic material, I investigate that material at 35, 37 degrees. Carry on making accommodation. Is adapting at any change. And one measure you can use in any patient. It's the first and only device designed to counteract the negative effect of the malocclusion on the tonic postural system. Remove all the interferences. Remove all the interferences, and that's very important. It is the unique thermoplastic device that is easily personalized by rehabilitation therapies according to the specific needs of each patient. Obviously, they have to be trained. With a single device, it will be possible to finalize all treatment in balance, getting the body into the relaxation required to perform treatment easily and effectively. With the simple use of the hot water, therapists can model the device in a functional manner and repeat as necessary during any phase of the treatment. That say that this device is avoiding one of the main disturbers of the muscle chain, what is the craniofacial system. You said during manual therapies, exercise and sleep, we advise to use that when the patient sleeps, when they do exercise, and also during the physical rehabilitation. Successfully counteracts the masticatory system's negative effect on posture for long-lasting results. It's a very important device. This device is annulating the functional area who is under dysfunction and have different parts that's for the buccinator, for the neuromuscular effect on the front, palatal part for support, proprioceptive support. These areas, this area and the front outer shield have a neuromuscular effect also. This is for the buccinators area. This is the part of support and tongue reeducation. It's a really, really functionally stable device, and it's a myofunctional device who we use during the treatment and to protect our muscle change. That's very important to understand that. With this device, we will avoid the negative effect of the craniofacial system, who is affecting the muscle change. Imagine that important device. Want to learn M.P.R? And this is a seminar to encourage you to go to learn M.P.R. If you want to learn M.P.R, we have courses. We have guest courses, register. We have a new course in connection with the spine center, spine action, sorry. It's the second time we do that in India. And that will be the second of a long-term courses in there. If you want to register, register there. And this is a course for all medical science, and that's medical doctors, dental doctors, physiotherapists, osteopaths, all together to understand the fundamentals of the M.P.R. And it's only with your computer. You will stay at home. You will stay at home in your houses like now, in this virtual room. This virtual room is our virtual room. We do all there. It's all online, the course, with your PC and with your tablet or a smartphone. Also, if you like, you can stay with us in your home learning the M.P.R. concept. And these courses, they have two certifications. One certification of our school and one certification of the Y University. It's an international university. It will be 6 classes for 2 hours. Wherever you are, you can follow the lectures. The classes are in our online classroom. You can raise your hand, a question, you can talk with me directly, and the classes, they will be registered, and then you can listen again the classes, and then study at home. And then you will receive also the PDF of any lectures. And it is open to all specialists of the physical rehabilitation. You will be into the holistic interdisciplinary diagnostic and therapeutic protocol and tools. Remember that, that is very important. What you will learn what is M.P.R, what is the myofunctional postural rehabilitation. You will learn the effect and the treatment of muscle change, the neuromuscular diagnosis, the postural and clinical diagnosis. You can learn also posturometry. You can learn the B.E.D use, the treatment plans and protocols, and much, much more. Join us in our networks. Follow us. You will see a lot of information in our networks also. You will learn in these classes a lot of things, a lot of things that you can apply immediately. And we will do a final test, and then you will have the university certification. Learn diagnosis of all postural pathologies and identify the root and cause of the problem. And you can learn how to deal and treat it. The Y Universities is connected with us, and they will do the certification for all of you. And learn the interdisciplinary treatment plans to incorporate in your therapies. Open to all rehabilitations and health science specialists interested in learning about postural well-being for physical rehabilitation. It's a method applied in all the world, in America, in Europe, and in Asia. Welcome to the M.P.R. And that was an introductory webinar for us. And this is the course. These are the telephone numbers and where you can call also for the spine action. And then you can register with them. And then you can learn our method. Remember, this is our Facebook and our mails also. And it's coming shortly, the book in English for the M.P.R rehabilitation. So next year will be, it is in 2 languages now, is in Spanish and in Italian, and the book next year will be in English also. Remember, this is the course This is the curves, and there you can deal with the spine action to register. Remember, is the 28th of November. We don't have a lot of time. And register now because there is limited places, okay? And this is the second time. The first group were very happy. This is the second one. And then after that, you know, when we finish this course, we also carry on study because every month when the course is finished, we will do a meeting together to do discussion of clinical cases. We do a continuous learning every month. We will do that in 3 languages, in Spanish, in Italian, and in English. Different days, not the same day. But we do clinical cases for all groups all around the world. And remember, if you want to register, you have there the details. And now, if you want to do some question, we are open to that, and then we can learn. If you want to do one question in the meantime, I will open the microphone to Krishna, and we have time to do question, and I will answer the queries of you. Hello, Krishna. Do you want to tell something for the people?
Hello. Yes, sir. Firstly, I would like to thank you for this wonderful webinar today. Thank you so much, and thank you for sharing your knowledge with us and sparing your valuable time for us. It was a wonderful class. And to all the participants, I would just like to make a quick announcement. As sir mentioned, that we are starting our webinar of online course of myofunctional postural rehabilitation, 6 days virtual online workshop. We'll be starting it from 28th of November, and this is going to be the second successful batch. We had our first successful batch, and we have got amazing results and reviews from the participants, and we are really very happy, and we hope many of us will be joining for our second batch. So for more details about the registration, you can contact Team Spine Action. We have given the contact numbers and the details of our Team Spine Action members. So I would just like to brief about the 6-day online workshop. The best part is you'll be getting the recording, so you can sit back and read about it, and you get ample of time to understand. Plus, there'll be a lot of practical demonstration of the patients. So we'll be showing many of the cases. So it's going to be a wonderful. It is an eye-opening session. I would like to say that you'll understand the root cause of it and the holistic approach to treat a patient completely. So it's going to be a wonderful class, and I'm hoping many of you will be joining the class. So please do contact Team Spine Action. And thank you all for joining us today. Thank you, sir, once again on behalf of Team Spine Action for the wonderful class. Thank you very much.
Thank you so much, Krishna. And I think we have some question right in there. Let me open the chat, okay? Let me open the chat and I see if we can answer. Let me 1 second. Okay, let me see. Let me close here. Okay, there is a lot of people from different parts. Okay, this is people who they say to us hello. Okay, and let me go down to, because I see some question there. Okay. No, this is all. If you want to talk with us, he's overwhelmed to get a significant about craniofacial system. Okay, that is a new concept because the people don't know very well what happened with craniofacial system. But if you want to, if you can raise the hand in there on the lower part of the. Okay, that we have one of them. Okay, Dr. Barnett. Okay, I could give you the open the voice. Hello, how are you, sir?
Hello, sir.
Hello?
I want to know if you can guide about the occlusion and foot support once again.
Sorry, could you repeat slowly?
Occlusion and foot support. Can you please just explain once again?
Yes, I can explain that. The occlusion and the foot support, okay? What happened in, I will give you the microphone open, just we can talk together, okay? Give the hand up until I tell you, because if it's not, I can go to close the boys before. It's very difficult for me. Leave the hands up there. Don't raise it down. Okay. Okay. Then I will go down with the presentation. Let me go in there, and I will explain very, very deeply what happened. When we have that is okay. Okay. Imagine in our body is the jaw. The jaw is pending, is moving, and is changing his central position because when we open and close the mouth, you see my hands there. When open and close the mouth, maybe we found pre-contacts. Imagine if we have pre-contacts who do some change in the central relationship. Okay? What happened? When this position of the jaw is changing, I studied that many, many years ago, creating myself the pre-contacts in each teeth. Imagine we can fit in each teeth. I create the temporary pre-contacts to observe with an instrument what happened in the foot. And if you see that, this picture, you see that in this picture, we have in the foot support 3 important areas. I will write it to you. We have here one area of support that is the first metatarsus. Here another support area, the 5th metatarsus, and here another one who is the calcaneus. What we observe in that research, anytime that we put pre-contact in the frontal part of the mouth, we create that right or left. If we put the pre-contact created on the anterior teeth on the left, immediately we observe that on the same side, on the left side, was losing the charge, the overload in the first metatarsus. Frontal area, homolateral, connected with the load into the foot in the first metatarsus. Anytime we creating on the side, in the teeth, we call that occlusal plane when we bite, when we trim the foot. In this area, every time we create pre-contact, we lose charge the same side. That means if we create on the right, we will lose on the right foot charge, overload, the load into the 5th metatarsus. And any time we create it artificially on the back of the teeth, we observe a diminution, decreasing of the load in the calcaneus. This is the schema. The frontal teeth, anytime we put here, imagine I will give you a draw. I will do a draw. Imagine we can create artificially pre-contact here in this area. When we create that, the body escape. The body escape to the other side. And the area who was less loaded was the first metatarsus. Imagine, we created also, let me write it down here. If we create over pre-contact here in this area of the teeth, the jaw also escaped to the other side. The jaw changed position and the overload was in the, let me write it down here, okay, was into the fifth metatarsus. And anytime we created this area of the occlusion here, pre-contact, also the jaw is going to that side homolaterally and is losing load in the calcaneus. Imagine if that persists chronically. What happened with our foot? Our foot support will be altered. That is the connection. I don't know if you understand well that, doctor. Yes, Dr. Kaur?
Thank you so much, sir.
Okay.
It's much clear now.
Okay, thank you so much for your question.
Thank you.
Thank you. Dr. Kumar Abhishek, yes? Do you want to ask me something? Yeah? Hello? Dr. Abhishek? You have the voice open now? You have the hand raised? Hello? It's not voice, okay? Anyone want to ask, to do some questions? You can raise your hand and then tell me what is the question, and I can answer the question to you. If we was not clear the whole concept, okay? Because it's a concept that we don't know really, and then when we don't know something, it's very difficult in one day understand that. Okay, we have another two questions. Dr. Bayas, Dr. Darshi, yeah. Hello?
Yes, sir.
Hello.
Can you hear
Yeah.
me?
Yes, I hear you. Yes.
Hello.
Yes, yes.
Hello. First of all, thank you so much, sir. It was a wonderful session, and we learned much in 1 hour only. I had one question that in initial slides you talk about convergence test and occlusion of teeth. Can you just tell about how we can conduct on our patients the convergent test? Since I
Yes.
was not so.
Yes, it's very difficult. I will leave the hand up and I will open the microphone later, okay? All right. Okay, listen, we go, it's very difficult in one hour teach you that, but I will try, yeah, okay? Let me go into the slide, okay? The test of convergence, what happened with the function, is a functional test. The convergence is a functional test. We will go to one of them. Imagine that, okay? The oculomotor system can move well if the internal muscles are working well. It's very difficult in 1 hour explain the whole neurophysiology, but when the occlusion is changing the jaw position, is altering the neurophysiology of the eyes movement. The test is very simple. It's a test who, when you say a patient to focus the eyes in the middle, the system, if it's working well, can keep the position for 15 seconds. After that, it's tired and then lose the movement, the position. If we do the test and the subject cannot keep the position, the internal position, for 15 seconds, we said there is an hypoconvergence. And how is the test? We put any thing with point here. We start for a distance from here, maximum 10 centimeters, and we slowly move forward to put into this area. And we said to the patient, keep viewing that point. If the subject have a good hypoconvergence, can stay there for 15 seconds. And this is the test I show you. Let me go here down. Okay. And this is the test. As you see, we say we move the point, and we said point. This guy cannot. Both eyes cannot move and keep the position. That situation we call bilateral hypoconvergence. That is the test, and it's a very, very significant test. Okay? Do you understand? Yeah, I open the voice now. Yes, do you understand?
Yes, it's clear now, sir. Thank you. Thank you, sir.
Thank you. And it's very important to understand that this alteration is connected with the jaw position. Dr. Shanawaz, you have the mic.
Yes.
Yeah, hello?
Yeah, good evening, sir. Thanks for such a wonderful and fantastic presentation. It was an eye-opener for us. Look, we have been hearing the things for the first time. So I have a question. I have read somewhere, actually I am much interested in trigger point management. I have been doing that a lot. Somewhere I read, like, if we have a trigger point in buttock, generally I am talking, or in soleus muscle, and there we can have the pain in the jaw.
Yes.
Is there? Yeah. So please elaborate it a while, because the reason was not given there, even though it might be related to the, kinetic muscle chain and other things. So can you please explain that?
Yes, I explained that the pain in the muscle jaws. I will put that in silence a little bit, okay? Okay, because it's very difficult in 1 hour to explain all this, but what is the key? Why we start with this problematic? And the key is the bruxism. All people think that bruxism is a stress problem. And bruxism is not a stress problem. I cannot explain here the whole physiology of the TMJs because we have not a lot of time. But the TMJs have 4 types of receptors. One of them, the most important of them, is in the back of the joint. And this receptor is a receptor for pain and for not adaptation, and it's a quick reaction. That means that any situation that is creating some problem into the joint with the change of the position is starting the very quick and bad defense we have, that is bruxism. The central nervous system knows that is something who is interfering here in the position. They have to start the bruxism to destroy the teeth, to liberate the joint. And it's a very bad defense because it's destroying the teeth and it's creating a lot of hyperactivities in the craniofacial muscles. And that is why sometimes we have a lot of pain. But the pain is in the muscles. And normally, as a physio, we treat the muscles. We relax the muscles. In the body also, we do relaxing. There is techniques, good techniques. But the cause for this pain is because the occlusion of the teeth is blocking a bad position of the jaw, who is creating dangerous for the joint. The joint, the temporomandibular joint, is a particular joint that accepts traction, but does not accept pressure. Anything that is increasing the pressure in the area is creating damage. And the central nervous system have a defense with the bruxisms. He said, something happened there. I start the bruxisms, destroying the teeth to liberate the joint, and it's creating a lot of problem in the whole body. Do you understand? It's clear the answer for you, sir?
Yeah, thanks a lot, because it will help me in, treating a good number of patients, because I had earlier and will be having. So thanks a lot for such a wonderful discussion. Thanks.
Because that is why when I invent the bed device allow all of you, all the people who want to annulate this situation, is a protection. Even if you do not treat the teeth, that is a protection. And with this protection, we avoid a lot of problems into the tonic postural system. This is the question, because something who is not working in balance between the receptors of the tonic postural system is creating a lot of problem in our posture. That's why I said it is impossible to do a good rehabilitation if we don't take care in these concepts that I'm saying. If we don't put in balance that, we will never can do any rehabilitation. I am talking local or general rehabilitation. Even for the dentists who want to do a teeth rehabilitation, if they don't take care on this old concept, that rehabilitation will be not permanent. And the same for the physical rehabilitation, for the doctors, for any rehabilitation. If we do not take, if we don't understand this concept, it's very difficult to have good, when we're talking in rehabilitation, it's a big word. It's rehabilitate something to work than before when was good. That is rehabilitation. And how we can rehabilitate the body if we don't take care of the whole body, of the total body. That is M.P.R. M.P.R is this, the myofunctional postural rehabilitation, teach all the disciplines to understand that and to treat that in a global and holistic concept, okay? All right, I think we don't have more questions. We have Kumar, but it's not the microphone. Kumar, can you talk with me? Is the hands raised there? No. Oh, okay. I think the topic was clear. I think if the Krishna, we can tell the people the seminar is finished now. We have to take. Thank you everybody to be here. We have 55 persons in the virtual room, and more people in the Facebook following us. And I want to go again to the topic, to the presentation of the course. First is at the end of the month. If you want to be there, please register in our course. Take contact with us, and then you will be it's a nice course for all medical sciences in your house. Like today, we can talk together, we can discuss together, and we can stay together learning the M.P.R. Okay, I think I think we can close now the meeting. I have to say thank you so much, everybody, to be here. Thank you, Krishna. Thank you, Ashish. And let me tell if you can talk, Ashish. Hello, Ashish.
Yeah, thank you.
Okay, you
Yeah,
have the microphone open. You can talk now. Hello.
Thank you so much, sir. It's a wonderful concept, and I've been using this device, a body equilibrium device, for the past like 3-4 years, off and on, and it has got wonderful results. I can say, for as per my experience, that changes the whole actually the kinetic sense of the body, and realigns the body as one can feel it. So
Okay.
I'm looking forward to all the participants to learn this concept and apply those who have been working and treating body asymmetry and body alignment. So it's a wonderful concept and treats the person as well. So looking forward for it myself as well. Thank you so much, sir.
Okay, thank you so much, Anish. Okay, thank you everybody to be here. I will close now the transmission and the virtual room also, and I have to say bye-bye, and I will see you next in the next transmissions in Facebook and in the course. If you want to be with us, please. I want to see you, a lot of you. And I have a question. Is 6 days and now to learn? Yes, it is. We have 6 lectures of 2 hours, and then you will learn the whole concept of the M.P.R. Yes, it is. Yes, this is enough. Okay, and then we carry on doing another things, if you like, in the future. Another courses, small courses for another topics. Okay. Thank you so much, everybody, to be here. I want to finish the transmission of Facebook now. Okay, bye-bye, everybody in Facebook. Bye-bye for you who be here, and then we prepare for the people who be here in the virtual room. We prepare the certificates and we send by mail the certificate of this class. Okay, bye-bye, everybody, and I will see you the next